Thanks, Mr. Gottfried. A couple of quick questions for you. I've been kind of scanning through the bill as quickly as I can. At the beginning of your comments, beginning of the debate, you spoke about high-paid CEOs and how the insurance industry is among the highest-paid CEOs. Is that correct? I was just wondering where you got that information from, because I wasn't able to find that. I guess I would say, are you including the pharmaceutical industry in that?
Yeah, actually, we saw a news report that came out just a few days ago that talks about the fact that CEOs of health insurance companies are, as a group, have the highest median incomes of any sector of the economy. Now, you know, if that's a little off, and drug company executives get paid more than the $66 million a year that the CEO of United Healthcare gets paid, well, okay. But I would still think $66 million a year for a CEO of a company whose major function is to say no to consumers is an enormous amount of money.
It is.
And whether drug company executives make more than health insurance company executives, you know, is interesting to talk about. But the bottom line is we spend outrageous amounts of money on health insurance companies whose main function is to stand between us and healthcare. And we don't need to do that.
Well, I don't necessarily agree that their main objective is to stand between us and healthcare. I don't think they'd have very many customers. But the reason I brought that up about the highly paid CEOs is I looked at the AFL-CIO.org website, top 100 paid CEOs, and actually only one on that list is an insurance company executive. Many of them were pharmaceutical executives, and actually the highest paid industry out there is media right now. Those are the highest paid group of CEOs, followed by oil industry executives, and then I would assume pharmaceuticals, just going off of the list. So I was just kind of questioning if you included pharmaceuticals in your analysis. And the reason I ask you that question is, tell me if I'm wrong here, but this bill, if enacted, would serve the purpose of basically eliminating private insurance companies in New York State. Maybe I'm wrong, and if I am, please let me know. But it seems to me that private insurance companies would be out of business if this came to pass.
Well, first of all, the number I was referring to was the median income of CEOs in the industry. There may be individuals in other industries whose salaries are higher than the highest paid insurance executive. But frankly, I don't know why we're so fascinated by that. An industry in which people are paid tens of millions of dollars, even if somebody else is paid a little more, the point is we're spending an enormous amount of money on paying people to do work that doesn't provide health care. Now, you know, you asked about drug companies, or you mentioned drug companies. One of the main sources of savings in this bill is that the New York Health Plan will be dramatically more effective at bargaining with drug companies to bring down their prices, because it will be bargaining on behalf of 20 million covered lives, many times more than any insurance company.
Thank you. Yes, and I'm not fascinated by the highest paid CEOs. I'm simply pointing out that if it's put out there as fact, and in fact it's not fact, then we have some other questions that come up. And the reason I ask this is, and you are correct, by the way, let me just say, you're correct that they do have the highest.
If you're suggesting that I made up the number and I'm lying, I'm kind of offended.
I'm not. I'm not really concerned if you're offended. I'm simply putting out there.
I know you're not.
I'm not at all. I'm simply putting out there that if you begin your statement with facts that are not fact.
The fact that there is a drug company executive who is one of the most highest paid in the country does not dispute the fact that the median salaries of CEOs of health plans are the highest of any sector in the economy. And again, even if that's wrong, even if they're only in the top quarter, so what? The point is that we are spending an enormous amount of money on these people, and we do not need to.
Yeah, I got you.
That's the point. And if you think that
the
our
point
healthcare
earlier.
dollars ought to be paying tens of millions of dollars to insurance company executives, well, you can tell that to your constituents. I wouldn't want to tell that to my constituents.
I didn't say that. I simply said that if you're putting something out as fact, you can't expect not to be questioned and then be offended when you are questioned.
Well, but it is fact.
It's not fact, but that's neither here nor there.
So,
Listen,
so
here's the
I'm
point.
lying?
I didn't say you're lying. I'm just saying you put something out there as fact, so let's say you stated a mistruth. Let's leave it at that.
Although the evidence that you cited relates to a different set of numbers, it doesn't relate to the median income of the executives, does it? It doesn't.
Media heads rule the ranks of the best paid CEOs, Associated
Press. It doesn't refer to what the median income of the CEOs in the industry are.
Yeah, the healthcare industry is among the highest, not the highest. But regardless, here's why I asked the question. If this bill has the effect of essentially wiping out the private insurance industry in New York State, along with the hundreds of thousands of employees who I was told the other day could just be repurposed as if they were widgets, if indeed you wipe out the private sector insurance company, why would you stop there? Why would the state not take over the pharmaceutical industry in New York and wipe them out as well? Because clearly, rather than negotiating with them, we should just take them over and dispense the drugs ourselves.
Well, several things. As long as we're talking about making up statistics, there are 26,000 employees in the health insurance industry in New York State, not hundreds of thousands. And an industry whose main job is, or should be, to process claims, that's something government is very good at. Whether you look at the Social Security program or the Medicare program, what a single-payer health plan does is radically different from what an industrial and research company like a drug company does. And there are people who would make a case that we should have government ownership of drug companies, but that's a utterly different question from whether the public should be in charge of paying for health coverage. The two kinds of companies bear no resemblance to one another whatsoever, except that their CEOs are both making an enormous amount of money at our expense.
They are both making a lot of money at our expense, there's no doubt. In fact, I think you can make the case that the pharmaceutical industry makes more, and if the purpose of your bill, as you've repeatedly kind of stated, certainly along with what you say will be providing better health care, would also be to save a heck of a lot of money, I think it might stand to reason that the state may take the next step and just kind of encompass those pharmacies, because why not? We should wipe that out industry too, I guess.
I said why not, because running an industrial and research giant is a very different kettle of fish from running a program that pays claims. What the New York Health Act will do is empower the program to dramatically bring down the price of what New Yorkers have to pay to those pharmaceutical companies, because it will be negotiating on behalf of 20 million customers, which is a whole lot more than any insurance company is negotiating on behalf of.
But actually, I wasn't talking about the research end of pharmaceuticals. I was talking about the dispensing, the CVSs, the Rite Aids. Simply don't need them anymore if we continue the next step down the path, I would assume. But
well, again, running a retail operation is dramatically different from paying claims.
What would be the impact on the cost? Because you did point out that there could be some savings here, whether they pan out or not, but your numbers show that there could be some savings. But are they not based on us getting a waiver from the federal government largely? And what would be the impact if we do not get the waiver from the federal government?
Well, first of all, when you say some savings, that's an interesting way to refer to net savings of $45 billion, which is about $2,200 for every man, woman, and child in the state. To call that some savings is, I think, an understatement. But to directly answer your question, none of those savings is in any way dependent on getting any waiver from the federal government. That goes to the question of how simple the state's end of operating the system will be if the federal government agrees to essentially merge Medicare into the New York Health Act. That will make everything much simpler. But even if they do not grant us any kind of waiver, the New York Health Act will function as a wraparound program to those programs. It will be seamless to the consumer and to the healthcare provider. The state's computers will have to keep track of what's what, but getting a waiver or not has nothing to do with the net savings that the program will generate. And if you read the economic analysis, that's very clear.
Okay. And just back to the question, I hate to reiterate it, but it wasn't clear enough because I've been scanning the bill trying to find what we do with our retirees, and that number grows and grows with an aging demographic and many of them exiting the state. I don't know the exact number, but about 100,000 people a year exit New York State. And many of them are retirees, and I'm unclear how we proceed with the bill because the Constitution says you can't diminish a retiree's benefits, and if it's not clear what we're going to do if this bill became law, then how are you potentially not diminishing a retiree's benefits if we don't have any clarity on what we're going to do? And I guess, I hate to ask you a two-part question, but if the employer that they were employed with is no longer participating with the private insurance company because they're gone, then what do we do? I'm not quite sure how we would handle that.
Well, I can't account for what degree of clarity you have, but the bill makes it clear that retiree benefits, particularly for people who move out of state, can continue to be paid. And to the extent that there is law that requires them to be paid, they will be required to be paid. Let me finish.
Go ahead.
A retiree who stays as a New York resident will not only get the benefits they are entitled to today, they will get a much richer benefit than they are receiving today.
But I think the problem is that unless it's somewhere else in your bill, page 6, line 35 says the board shall develop proposals. That's anything but clear. It simply says they're going to develop proposals for, the first thing there is incorporating retiree health benefits into New York Health, accommodating employee retiree health benefits for people who have been members of the New York Health but live as retirees out of the state. So it goes on from there. But I just don't think it is clear, and I think that's some of the problem with the bill. Unless it's somewhere else, and if it is, please enlighten me.
Well, as I said, I think it was, well, to one of your colleagues, maybe more than one of your colleagues, the provision that I'm talking about is on a different page of the bill. It is not the provision that you were reading. It's a different provision of the bill. While I'm standing here answering questions, it is difficult to simultaneously be reading through the bill to find that language, but it is there.
Certainly understand, but you have some assistance there, so maybe he's made it a little more clear about where it is.
Okay, actually, good point. If you look on page 4, provided, however, that this subdivision, which is the one that says you don't that people won't be selling health insurance.
Could I ask the line?
Down on line 40, on line 50, shall not prohibit the offering of any benefit to or for individuals, including their families, who are employed or self-employed in the state but who are not resident of the state, or B, the offering benefits during the implementation period, or the offering of retiree health benefits. And to the extent that those benefits are required either by contracts or by the state constitution, the fact that the bill allows them to be offered, combined with the mandate that they be offered, means that retirees will not be interrupted.
The section you just referred to does not at all talk about retirees. Not at all. Talks about employees, their families who are employed or self-employed.
Line 55, Clause C, the offering of retiree health benefits.
I'm sorry, gentlemen, your time is up.
That's not on page 4. Thank you.
To clarify, it may be that Mr. McLaughlin is reading a bill copy that has different page and line numbers from mine, but if you find section 5101 of the New York Health Act, subdivision 4, clause C, that's the language.